Assalamu alaikum and welcome back to another episode of What's Up Doc. I'm your host, Dr. Alia Al-Barwani, and I'm a board-certified physician. My show, What's Up Doc, is a production of Muslim Network TV, the only Muslim-focused network broadcasting in North America. You can find our show streaming almost every day on our website at muslimnetwork.tv and on our YouTube page at youtube.com/Muslim Network TV. You can also watch our shows on Roku TV, Apple TV, Fire, and Galaxy 19. In a previous episode here at What's Up Doc, we talked about dental hygiene and the importance of dental hygiene. But in today's episode, we're going to focus on pediatric dentistry. Joining us in that discussion is Dr. Adil Khan. Dr. Adil Khan, or Dr. A as he prefers to be called by his patients, has been practicing children's dentistry for over a decade. He graduated from Boston University School of Dental Medicine and then went on to complete his residency in pediatric dentistry. He's board certified through the American Board of Pediatric Dentistry. He lives in Katy with his lovely wife and his 2 children. Welcome, Dr. Khan. It's such a pleasure to have you on the show.
Same here. Assalamu alaikum. I'm privileged and honored to be here and talk about exciting stuff as children's dental health and kids' teeth.
Yes, absolutely. It's always exciting. I love taking care of children. It's one of my favorite things to do in family medicine. And one of the reasons that I chose family medicine, I wanted to be able to see pregnant women and children, and family medicine combine those two. So I'm always happy to be talking about things related to children. So tell us, let's just start kind of generally by talking about the difference between distinction, that is pediatric dentistry. Like I said, we have a previous episode where we talked about general dentistry, but pediatrics is a little bit special. So share with us a little bit about that.
Yeah, sure. So, just as any family dental practice, you have the convenience of going in with your family and bringing the children to them and having them see you for your dental care. And most general dentists are pretty good at providing that care, but pediatrics is specialized and different in a way that we have advanced training, more training. So we go back to school and get a residency in pediatrics specifically to treat children, treat baby teeth, provide oral sedation services, monitor growth and development for children, and really kind of take them from infancy into adolescence and kind of help guide their journey through growth from primary dentition, which is baby teeth, into adult dentition, which is permanent teeth. So we have that distinct connection and distinct education to kind of help the child through their growth and development. Not to say that no other dentist can handle that. Most definitely, more people are very competent and more knowledgeable. But pediatric dentistry does also bring in a special personality that not each provider has, to be able to connect with the child, connect with the parent on a personal level, and be fun, crack jokes, and make them feel comfortable. So big difference in pediatrics versus any kind of specialty is really the personality, the ambiance, and the environment that the child and the parent experiences in the practice, with the providers, with the staff that works with them too, because not each person's personality suits in working with kids. So specialized education, advanced training with 2 years, spending time learning about sedation options, learning about growth and development, from infancy to adolescence, learning about, fixing cavities on primary teeth, providing services to special healthcare needs patients. So that's what makes us unique and different from any other specialty in dentistry.
Excellent. Thank you for clarifying and going into those details for us. So when we talk about seeing, as you said, there's this ambiance, there's a specialty. When we talk about that in terms of a parent who wants to know how early they should bring their child in to have their first dentist appointment, for my patients, I'm usually like, hey, if there are teeth in the mouth, you need to be going to see a dentist. So what's your recommendation for that? How early? And a lot of patients look at me like, really? It's this is their first tooth and it's barely in. So when should parents start thinking about bringing in their child for their first visit, and how often do you recommend that they come in?
Right. I mean, you're spot on, really. I mean, we, the American Academy of Pediatrics and American Academy of Pediatric Dentistry have a joint policy on this, and they recommend that when you get your first tooth, you should have an established dental home, right? And or most definitely by your first birthday, you should be able to get a visit in with your dentist, or specifically, or especially if you can, with a pediatric dentist, right? The reason is that even though they may not have a number of teeth to look after or clean or really examine, really it's just to establish what we call a dental home for your child, right? The reason is that we talk about prevention, we talk about hygiene, we talk about diet, we talk about habits, we talk about basically laying down the foundation for your child's dental health for the rest of their lives, right? So a lot of anticipatory guidance, lots of diet counseling, lots of hygiene instruction, just talking things through and make sure you're on a strong footing to start off your child's dental health. So we can prevent issues such as dental cavities. We can prevent issues as malocclusions or orthodontic concerns. We can prevent or be a resource, especially if your child has an accident or a fall or trauma to their teeth. So at the last minute, you're not scrambling to find a dentist that is capable and competent to see your child. So studies have shown that children who start seeing a dentist as early as age 1 year have long-term less dental needs, meaning they need less dental treatment. They seek less dental emergent care at a hospital, urgent care. Their cost of dental hygiene or dental care overall in the span of their life is significantly less versus a child who comes in at age 1 onwards and is able to see us every 6 months for their maintenance and care. So prevention is definitely worth and goes a long way. So generally we see them every 6 months after you first come in for your visit. So we can keep track of growth and development, keep track of any early signs of cavities, and continue to guide you through your dental experiences and dental growth. Unless there is more concerns that we see. So sometimes in what we consider high caries risk patient, where we're concerned that if we don't see them more often, something bad may end up happening to their teeth, we may recommend every 3 months also.
Excellent. So similar to really when we talk about general health, where we're asking patients to establish care before you have a problem, that way we kind of have a baseline for you and you have a medical home. It sounds like similar concepts in dentistry as well. And it's really important, as you said, for prevention, right? If it's a lot of times prevention is not only cheaper, but safer than trying to cure something or fix something after the fact. So great advice there with establishing that dental home. Also along the lines of prevention, and when we talk about what to do in between those visits, as you said, it can average between 3 to 6 months, depending on what's going on in the child's mouth. In the home and in between those visits, of course, cleaning and brushing your teeth is really important. Let's talk a little bit about that when it comes to children. A question that I get often, I'm sure you do as well, is when should parents start using toothpaste? And is there a difference between the children's toothpaste that we see in the market and the regular toothpaste that adults are using?
Right, good question. So again, going back to our AAPD guidelines, American Board of Pediatric Dentistry, we recommend starting to brush your child's tooth as soon as the first tooth erupts. So we literally just hand you a toothbrush at your first visit if you even have one tooth, and encourage you to start using a toothpaste. We recommend a fluoride-containing toothpaste even at that age, even as early as your first tooth comes in. But it's very important that we parents understand how much toothpaste using it in excessive amounts can be harmful to a child's body. So using as early as you get your first tooth in, what we recommend is just a rice cereal size or a smear layer of toothpaste up to age 3. And then after age 3, we'll bump that up to a little bit more, which is called basically whatever fits on your pinky nail, or a pea-sized amount. So up to age 3 is a smear layer. 3 onwards is a pea-sized smear or pea-sized amount. Parents always question and do rightfully get concerned about the child eating the toothpaste or ingesting it, which is a valid concern. But really, it's about the amount you use. Even if they ingest and swallow that tiny rice cereal-sized amount of toothpaste, even twice a day, should not cause any toxicity or any risk to the human body. But it's important that we follow those guidelines. So yeah, obviously the choice is the parents, but we definitely do recommend starting the toothpaste as soon as your first tooth grows in.
Okay, that's really important to know. And thank you for sharing that, because another thing that you said is the safety with respect to ingestion, right? Children, anything you put in their mouth, they're going to immediately try to swallow. And so toothpaste is no different. Now, when it comes to habits, something that I'm sure you've seen, and we kind of put together with kind of something that children do naturally, is thumb sucking. We see a lot of children using that to self-console. And so let's talk about that a little bit, because sometimes I've seen, kids 6, 7 years old even still doing that. And I've noticed that it does impact the way that their mouth forms, or maybe that their teeth are forming. And I don't know if it's correlation or causation. So let's talk about that. Is there an effect of thumb sucking, on the way that children's teeth develop?
Yeah, most definitely. I mean, that is something that we counsel on, pretty much on a daily basis for our families and our children. And unfortunately or fortunately, non-nutritive sucking habits may be thumb sucking, pacifier use, finger sucking, is a soothing, coping mechanism for most children growing up. And it's totally acceptable to a certain age or a certain point, right? So we are okay with children using a pacifier to a certain age, or babies using a pacifier up to age 1. But we do recommend starting to wean off, soon after, and ideally anywhere between 18 to 24 months. Would be an ideal age to wean off from a passy. Same goes for the thumb sucking. It is a coping or a soothing mechanism, so sometimes it does get hard. We do have some tips and tricks that we can share with parents that will help them, hopefully get them over the hump. But let's talk about first what it can cause in a developing mouth, and how it can lead to malocclusion, or teeth that don't look ideal or natural appearing, right? So what a thumb or a pacifier does to your growing jaw, especially the palate, is that it puts constant forces on it, depending on how often, how frequently, and how intensely you're using that habit. And if you do it enough, it is going to make your upper jaw narrower. And when it does that, it pushes your front teeth or incisor outwards, giving them the appearance of having buck teeth, where your mouth with the top and bottom teeth doesn't overlap together, and your teeth are in procline, so you have an opening between your upper and lower teeth. So that's a very, serious orthodontic problem. So prolonged use of thumb sucking, even a pacifier or finger sucking can definitely lead to serious orthodontic issues. So generally, a good idea is to wean off 18 to 24 months if possible. The longer you do it, the more the chances of you needing extensive orthodontic treatment to fix those issues. We have a number of ways that we can help our patients, or our babies or children. Really, positive enforcement goes a long ways. If it's the thumb sucking, there are a number of products on the market that we can use as well. But the most important thing that we find is that parents taking a positive approach to it may be just encouraging them, explaining it to them, why this habit is bad, maybe having a star and to use and incentivize it by helping them reach a certain, like, let's say if for in a matter of a month, if they don't use that habit for a number of days and they get a number of stars, they get a fun activity out of it or a fun prize out of it. There are products on the market that are available and on Amazon that cover up your thumb entirely. It's just called a T-guard. There is also something that prevents your elbow from bending, which is called Nip It. Both those products are available on Amazon that physically prevents you from sucking your thumb. But we see that sometimes it doesn't work if we don't have the child's cooperation on board, or they're not mature enough to understand why they're going through that exercise. So the child has to be mature enough to be able to utilize some of those strategies.
Very interesting, very helpful strategies that you described. A lot better than what some of my patients have described that they do, which is to dip their finger in chili. And so they learn a lesson every time they go to suck their thumb. That's a really, really hard lesson to learn. So I like that. Definitely a lot safer and positive reinforcement that goes a long way when the child is able to understand. So I love that. Now, another habit that I see, and this is more on the aspect from the parent side, is bottle propping. And so, some of the children that you're seeing, because you do see them as early as a year, may still be in that stage, or younger than a year, may still be in that stage. And when it comes to medical, from a medical perspective, there is that risk for ear infections. And so we definitely don't recommend it on that respect. I know that there are also some effects on dental decay. And so I would love if you would speak on that a little bit.
Yeah, for sure. Dental caries is an experience that's based on three big factors. Your hygiene, your diet, which the bottle feeding falls under, and your genetics. But bottle feeding, especially through the night, and frequent use of it can lead to baby bottle decay, right? Because that's what ends up happening if you're bottle propping or drinking through the night, is milk is just pooling up on your upper jaw, especially around the upper lip area. And what ends up happening is we see that quite commonly, where if the child is extensively bottle feeding through the night, especially, that they present with extensive dental cavities, which are called early childhood caries or severe caries on all the four front teeth, maybe even extended up to the canines and even sometimes the back molars. That is very concerning, and that needs to be either treated traditionally with drilling or fillings, or some other alternative treatment options. And generally, we definitely do encourage parents to try to minimize nighttime feeding, minimize the duration of feeding, and making sure that they are brushing their child's teeth at bedtime after the feeding if possible, or at least wiping the gums or the teeth with a clean washcloth to minimize the risk for baby bottle decay.
Excellent. Thank you. Now, we do have to take a quick little break here, but don't go anywhere. We'll be back. You're watching What's Up, Doc, here on Muslim Network TV, and we'll be back after this short break. Assalamu alaikum and welcome back from our break. You're watching What's Up, Doc. I'm your host, Dr. Hadi Al-Barwani, and today we're joined by Dr. Adil Khan, and we've been talking about pediatric dentistry. So before the break, Dr. Khan, talking about essentially just different things that we can, parents can do to help ensure good healthy teeth for their children, especially after feeding. So I want to change gears a little bit here and talk a little bit about what you were mentioned in the beginning of this show with respect to baby teeth and permanent teeth, and what exactly that means for someone who may not have heard those two terms before. Let's start with that, and then we'll kind of talk a little bit more about the care for baby versus permanent teeth too.
Sure. Usually the baby or primary teeth just appear different. They're obviously smaller, Then permanent teeth, especially the incisors in the front, are about twice as wide or bigger. So generally, we love seeing spacing in the baby teeth. That's a very common question we get: is my child has spacings in the front teeth? Is he going to need braces? And the answer usually is no, because those spacings will be filled up by the permanent teeth or adult teeth, which are bigger and wider, right? So we love that children have primate spacing or spacings in between the teeth. So baby teeth obviously are smaller. They're more wider, milky white to be exact. So another question we get is when your child is 6-7 years of age, is you get a set of incisors, permanent teeth in the front, and then their parents are comparing those to the baby teeth that used to be there, and comparing and getting concerned that the permanent teeth are discolored or are not looking good. So generally, permanent teeth are more gray to yellow hue or color versus primary teeth, which are milky white. So that's a very good distinction or change or difference to know for most people and parents. The enamel layer on the baby teeth is a little bit thinner or smaller too. So that can be good and bad. Bad in the sense sometimes it's easier to get cavities and cavities to grow quicker. So those are some big differences between primary and permanent teeth.
Excellent. And so when do we expect for a child's first primary tooth or baby tooth, as I keep referring to come in? And when should parents be concerned? Past what age should they be concerned if they're not seeing teeth come in?
Sure. Yeah, that's a very good question. So generally, a first incisor or the two front bottom teeth is what we expect for most babies to get. I've had a child get that as early as 3.5, 4 months, which is on the earlier side of the spectrum. You can take I've had children up to 16 to 18 months have no teeth. And that's still okay because each child is unique and they just grow at their own pace. There's nothing wrong with it. At some point though, if you're 2 and older, you don't have any teeth or closer to age 2, then we want to take some radiographs or x-rays to make sure that developmentally you're doing okay. So it can be as early as 4 months, and it can be as late as 14 to 16 months. And everything is okay as long as there's progression and the teeth eventually do end up growing in.
That is a very wide range, yes. So I wonder how successful are you at reassuring parents to wait that long? Are you secretly praying that they come in tomorrow? Did you say that to them?
Well, yeah, good question, right? So no, not exactly. It would be a miracle if they just grow overnight. But I think sometimes what's reassuring is just taking an x-ray and showing on the x-ray that, look, there they are, point those out. So as long, that confirms for us that our hunch is right, that they are there, they're just taking a bit longer, and it puts the parent's mind at ease seeing a picture with the teeth in it that, yes, they're there, they're just taking a while.
Okay, that's good. Now, as far as, you said that the permanent teeth come in and you described in good detail for us the difference. A lot of the times when permanent teeth get knocked out as it happens with the children playing and all the things that children love to do, there is obviously a higher risk, or if they're playing sports and things like that. What should parents do if that happens?
And dental trauma definitely is something that we see quite often, maybe in baby teeth or permanent teeth. So permanent teeth, for contact sports and injuries, it's a very common injury to have. You can have fractures, you can have complete avulsions where the entire tooth comes out or gets knocked out. It depends on how mature that tooth is, if the root is completely formed, and that dictates the treatment options for it. But generally speaking, hopefully most schools and sports facilities or teams have a special solution to store that permanent tooth in, which is called Hank's balance solution. Basically, it's a pH friendly solution for tooth storage. So if that is not available, if the entire tooth is out, you do your best to wipe off the dirt. Try not to dislodge too much tissue off the tooth, and you try to either store it in that special solution if it's available. If not, milk is a good substitute. If that's not available, you can even store it in spit or saliva. Some people have come in with the children storing the tooth inside their lip, so it's covered with saliva. But milk generally is a good solution to store. And really, ideally, you want to be able to reimplant that permanent tooth within an hour, if possible. If you're able to find a pediatric dentist or dentist or an urgent care facility or in a children's hospital that has pediatric dental residents on call, to go in within an hour and reimplant that tooth if possible, and you end up splinting it, putting a wire on it to immobilize it, and that is really the best thing you can do. So making sure that you first find the tooth, you store it in the right medium or storage solution, and then you try to see somebody within an hour if possible.
Okay. Yeah, you took me a little bit aback when you said you had children come in with it in their inner lip. I can only imagine. Actually, I can't imagine. That being said, do you then recommend that any child who's playing sports or specifically contact sports that they do wear mouth guards or some kind of protection?
For sure, yeah. I mean, contact sports, we definitely recommend. That's part of our, conversation and anticipatory guidance when children start playing sports. Mm-hmm. Baseball, basketball are not generally considered contact sports, but I've seen injuries associated with that too. Recommend mouth guard for them. Obviously, football, any sport, I would have encourage our kids to wear. You can get a custom mouth guard made by your dentist. If that's not something that's possible, you can even get a stock one from Amazon, from Walmart, CVS, anywhere. Shock Doctor is a good brand. So yes, most definitely encourage athletes in wearing those mouth guards and protecting their teeth.
Excellent. And then before we wrap up, you mentioned anticipatory guidance. It's really important because it's part of that whole prevention that we talk about, kind of sharing good habits and things like that with our patients. When I walk down the dental aisle, even when I look at the kids section, there is a lot of things that I wonder, do kids really need to be doing and at what age? And that includes children's mouthwash and electric toothbrushes for children, and of course, flossing. So talk to us a little bit here before we wrap up as far as how you counsel your kids when they come in for preventing tooth decay, which you mentioned earlier in the show. What do you tell them?
Yeah, so like we touched on earlier, right? Brushing as soon as you get your first tooth in, using a fluoride toothpaste as soon as you start brushing. We talked about the differences in the quantities, smear layer versus pea-sized amount, up to age 3 smear layer, over age 3 pea-size. We start recommending flossing when the contacts of your teeth end up closing up, or if you have crowded or crooked teeth to begin with. So that's very important to start flossing to make sure that food in between the teeth gets cleaned out so you're not at risk for gum issues or worse, cavities. Generally, that happens anywhere for most children about 2.5, 3 years of age. So the contacts close up, so you start flossing after age 3. We recommend using those plackers with the handles on. That's definitely an easier version of flossing versus a thread floss. Mouthwashes are a good adjunct and supplement to help prevent cavities, especially the fluoride-containing ones. Generally, we don't recommend that for children till age 6 because that's when they finally learn and are very good at rinsing and spitting. We don't want them to ingest or swallow that if possible because that can be irritating to the GI or gut. So mouthwash is till 4, 5, or 6 for most children.
Okay. And electric or manual?
Oh yeah, so manual till you're a bit older. till 2 to 2.5 or older. And then we definitely encourage if the children can tolerate a spin brush or electric brush. But you have to be careful with children, especially because they chew down or chomp down on the toothbrush. So you don't want to cause any kind of damage from an electric toothbrush. So 2, 2.5 and older is a good age to introduce an electric, closer to 3.
Excellent. Thank you so much, Dr. Khan. We really appreciate having you on our show today and sharing with us insights and valuable information about pediatric dentistry. We wish you every success in your future career.
Thank you so much. Jazakallah khair. It was a pleasure being here. I had so much fun.
Thank you, our viewers, for joining us on another episode of What's Up, Doc. I'm your host, Dr. Alia Al-Barwani. We hope you'll join us on another episode. Until then, you can watch our episodes on our website at muslimnetwork.tv and our YouTube page at youtube.com/Muslim Network TV. We'll see you next time on another episode.